The untimely death of former child actor Blake Garrett at the age of 33 has cast a stark light on potential flaws in the American healthcare system, particularly regarding access to pain management medications amid strict opiate regulations. Garrett, best remembered for his role in the 2006 family comedy, How to Eat Fried Worms, passed away on a Sunday, leaving fans, family, and the entertainment community in mourning. According to statements from his mother, Carol Garrett, shared in interviews, Blake sought emergency medical attention in Oklahoma the week prior due to severe pain. Doctors diagnosed him with shingles, a painful viral infection caused by the reactivation of the varicella-zoster virus, the same virus responsible for chickenpox. Shingles can cause intense nerve pain, often described as burning or stabbing, that significantly impacts quality of life. Carol suggested that her son may have turned to self-medication to manage the discomfort after his hospital visit, describing his death as potentially a tragic accident, pending autopsy results. Social media erupted with speculation and concern following these details becoming public. One user captured a widely shared theory: Blake likely went to the emergency room with unbearable pain, received a shingles diagnosis, and was sent home with recommendations like ibuprofen, a common over-the-counter anti-inflammatory that often proves inadequate for neuropathic pain associated with shingles. In desperation, he may have sought stronger relief through illicit means, possibly purchasing counterfeit or contaminated painkillers from the street, leading to an overdose. The commenter lamented, "Sad, but that happens all too much with the opiate restrictions." Opiate restrictions in the United States refer to a complex web of federal, state, and institutional policies implemented primarily since the mid-2010s to combat the opioid epidemic. Initiatives like the CDC's 2016 Opioid Prescribing Guidelines, State Prescription Drug Monitoring Programs (PDMPs), limits on initial prescription durations, and insurance prior authorization requirements aim to reduce overprescribing, addiction, and overdose deaths. While these measures have contributed to declining prescription opioid volumes and some reductions in overdose rates from prescription sources, critics argue they have created barriers for legitimate patients in acute or chronic pain. In cases like shingles, where pain can be debilitating and short-term opioid use might be appropriate under medical supervision, patients sometimes report being denied adequate treatment. Emergency departments, wary of regulatory scrutiny, may default to non-opioid options or discharge with minimal intervention. This has led to anecdotes, and some studies, suggesting opioid-phobic practices that push vulnerable individuals toward dangerous black market alternatives, including fentanyl-laced pills that dramatically increase overdose risk. Blake Garrett's career began as a child, appearing in films and shows that captured the imaginations of young audiences. How to Eat Fried Worms, based on the popular children's book, featured him in a lead role dealing with schoolyard challenges and gross-out humor. Transitioning out of child acting is notoriously difficult, with many former young stars facing personal struggles, but Garrett's case highlights how health crises can intersect tragically with systemic issues unrelated to fame. The broader conversation sparked by his death touches on the opioid crisis's dual nature. While prescription opioids fueled much of the early epidemic, street drugs now drive the majority of fatalities. Policies restricting access have saved lives in some contexts but inadvertently harmed others by limiting doctor-patient discretion. Advocacy groups like the American Medical Association have called for balanced approaches that avoid undertreating pain, while patient stories continue to emerge of individuals suffering needlessly or turning to unsafe sources. Shingles itself affects about 1 in 3 adults, with risk increasing with age or stress, and pain management is a key component of care. Standard treatments include antivirals to shorten duration, but pain control often requires multimodal approaches, gabapentinoids, lidocaine patches, or in severe cases, short-course opioids. When those are unavailable or discouraged, outcomes can worsen. Social media discussions around Garrett's passing have amplified calls for reform, with users sharing personal experiences of pain mismanagement and questioning whether stricter rules have swung the pendulum too far. The tragedy serves as a poignant reminder that policy solutions must weigh public health risks against individual suffering, ensuring that efforts to curb one crisis do not fuel another. As the autopsy results emerge, they may provide more clarity, but the conversation about compassionate, evidence-based pain care continues.